With the treatment planning process complete, let's head on over to Meredith, where she can show us a DIBH workflow using Align-RT, as well as debut our newest product, DoseRT.
Thanks, Maddie. My name is Meredith Smith. I'm one of the clinical application specialists with Vision RT, and we're going to show you how to do the DIBH workflow here at our Align-RT Advanced booth. So the first thing you need when you're going to do a DIBH patient is you're going to have both a free breathing and a breath hold surface from your simulation. At that point, dosimetry would send those over and we would import them into our system, and that's what allows us to get our patient back into the correct position with the correct breath hold, exactly as they were in the sim. So we would import our free breathing structure set, and then we would get our patient set up exactly to that position. As you can see here, we have created a region of interest, which is over her left breast because that's what we're treating for her today. And over here, you can see we have gotten her in both her translations and her rotations set up perfectly to where she was in the sim. At that point, we can go to our video feature and actually make sure that we have her outlines of her arms, her chin, everything in the correct position, so we can ensure that we're not going to have to do any type of re-imaging because we're going to make sure all that stuff is correct the first time before we leave the room. As you can see, it actually picked up the outlines on her shirt, so if you take new reference captures going throughout the treatment, it is going to pick up their new position, okay? So once we know that we have the patient where we want them, we would switch over to our breath hold surface. As you can see, she's going to be out of tolerance because she hasn't taken a breath in yet. So at this point, we would coach her into breath hold. If you look here, this bar is actually going to simulate her vertical threshold, and she can see the same thing right here on what we call our real-time coach. So she can visually cue herself to the correct position. So we'll instruct her to take a breath in and hold it. So if you want to go ahead and do that, we'll watch her go into her breath hold. If she were to take an incorrect breath, we would want her to fix it herself. We would coach her to take more or less to make sure it's the same as it was in the simulation. Good, you can breathe. We would never adjust for her because that's how we make sure that we're taking the exact same breath. Once we know that we are in the correct breath hold, we can actually step out of the room and start our imaging. It's that easy. What we have now is we have a new product called DoseRT, and that's what we would use once we start treating our patient. So if you look up here, you're gonna see our new Horizon cameras. They feature an 8-megapixel wide field of view. They are the foundation for the future of SGRT. There's so many possibilities that come with these cameras, the first of which is our application DoseRT. You might notice there's some other cameras up here, these blue cameras. They actually allow us to pick up hypersensitive radiation light coming off of the patient when we treat the patient. So if you see here, we use something called Cherenkov imaging. So when the radiation hits the patient's skin, it actually emits this light that is typically invisible to the naked eye. Well, by using these hypersensitive cameras, we can actually see that light. So in real time, we can see where radiation is hitting the patient as we're treating them. Obviously, this is a simulation because we can't be treating patients out here in the exhibit hall, but it kind of shows you what a dynamic wedge would look like. This is great for any kind of error that may occur after we leave the room and get the patient set up. So if a chin were to come down into the treatment field, we would be able to see it in real time, stop the beam, go in and make that adjustment. Maybe we have an arm that didn't get put up in the proper position, but we still have a little tissue in the field, fix it right away. See it on the contralateral breast, we can fix that. Maybe we need to pull some MLCs in because sometimes you can't see that on films, right? Another thing is bolus. So sometimes if we're treating a breast patient, we start at the lateral, we place our bolus and we say, we know where that field's at, we're good. You come out, you start treating and you realize you actually missed some of it. So you're not getting your whole field treated with bolus, okay? So another great reason that this is a wonderful new technology to help reduce mistreatments on patients. There's published data that says that from Dartmouth that they treated 64 patients and 10% of them, they found errors in their treatment that they were able to stop once they had beamed on because of the Cherenkov imaging. So between our Align-RT system where we can still watch our patient breathing and make sure they're in the correct position and watch for any kind of inherent error that happens after we set the patient up with the DoseRT, it allows us to give the safest and most accurate treatment possible for a technology that's never been on the market before.